Now, if you have been struggling to get an appointment with your GP, this next story is one for you. The problem has been raised in Parliament today by one of the MPs for Bedfordshire. Parts of that county have seen lots of new housing built, and now there is said to be real pressure on NHS services. Well, our political correspondent Ben Schofield was listening to the debate. He's at Westminster for us tonight. Ben, this came from Richard Fuller.
Yes, it did, Janine, and this is something that Mr Fuller told me he's been working on for several months, interviewing GPs, hearing from constituents as well about the issues that they are facing. Of course, we've reported about the issues on Look East ourselves. The data shows that across Bedfordshire and Milton Keynes, the ratio of patients to doctors is among the worst in the country. Mr Fuller says in his North East Bedfordshire constituency those numbers have got 28% worse over the past 8 years, and that, he says, is driven by poor recruitment of GPs, a lack of new infrastructure and huge amounts of new house building.
And I would point out to the Minister that housing growth in my constituency is already 3 times the national average. This is a problem that is not going to go away. This is not an issue that is going to stay the same. This is an issue which is going to get worse.
Now, Mr Fuller said he was very grateful for the hard work of GPs in his constituency, but he said one of them had told him that the vulnerability of the service provided by GPs was off the scale large. He wants the government and the Department for Health to commit to an infrastructure-first policy where new practices are built before housing developments are completed. That was something that the Minister responding to this debate, Maria Caulfield, picked up on in her response.
He will be pleased to note, though, that the point he makes about housing, and again, my constituency in the South East has similar problems where housing developments are in their thousands rather than their hundreds and spring up overnight with no consultation with the local GP, who then has to take those patients on. That I am meeting with the Housing Minister this month to discuss the very issues he raises about primary care being a key feature when planning is being considered.
Now, Mr Fuller is also asking the Department for Health to do a look back over the past 8 years to examine if there are any lessons learned from North East Bedfordshire's experience.